let's get started. I wish you all a good morning, a good afternoon, and good evening to all of you. My name is Simon. I work with the UNICEF Evaluation Office, and it's with great pleasure that I and all the other panelists who gathered here today welcome you to this webinar called From Crisis to Coordination: What have we learned from the evaluation of the collective service? This webinar is organized by the evaluation offices of the International Federation of Red Cross and Red Crescent Societies, short IFRC, the United Nations Children Fund, short UNICEF, and the World Health Organization, in short WHO. In this 1-hour webinar, we want to share with you the insights from a joint evaluation of the collective service, an initiative brought to life through a partnership between these same three organizations, so IFRC, UNICEF, and WHO. We will discuss how this collaboration has impacted public health coordination, its challenges and achievements, and strategic recommendations for the future. We hope that this session today will be rewarding for all of you, and we look forward to any feedback or questions you may have during the webinar. You can submit any questions by using the questions and answers chat that should be visible in your menu bar. Together with my colleagues Miki Tsukamoto from the IFRC and Anand Sivasankarakoro from WHO, we will do our best to address your questions during the session. Please also note that this session is being recorded so that it can be accessed by others who are not able to join us at this time. And let me point out that there is a French translation available. You can access the French language channel by clicking on the interpretation icon in the menu bar. Also for those speaking French, let me say that again. Mesdames et messieurs, veuillez noter qu'une traduction en français est disponible. Vous pouvez accéder au canal de langue française en cliquant sur l'icône interprétation de la barre de menu. To start, let me give you a quick overview of what we are aiming to cover in this webinar. But before we do that, we would like to learn more about you, our audience. As you know, we will be talking about the collective service today. To find out about what you already know about this initiative, we would like to invite you to answer a short poll, which you should actually see on your screen now. The question is, do you already know the collective service? And you can choose between not at all, I know a bit about it, or I am quite familiar with it. I'll give it just a few more moments for people to reply. And let's stop it here. As you can see, we have quite a mix of around half of participants who don't know about the collective service at all, and then about a quarter who says, I know a bit about it, and a quarter that says, I am quite familiar with it. No matter what your level of knowledge is, we want to make sure that you take away some new insights from this webinar. So let's have a look at the content we are aiming to cover today, and which will be brought to you by a range of different presenters. First, we will have a closer look at the collective service and the reason why it was created. So also to ensure that all of you know more about the service itself. Then we will look at the background of this evaluation, its purpose and methodology. Then the main part of this webinar will be the presentation of the evaluation's findings, conclusions, future options for the service and recommendations. And finally, you will be given some insight into next steps. So what is being planned or done as a result of this evaluation? And after that, we will hopefully still have a bit of time to answer any open questions. Before we now actually dive into the presentation, it is my pleasure to welcome Robert McCouch, the UNICEF Director of Evaluation, who will kindly kick us off with some welcoming remarks. Rob, over to you.
Thanks so much, Simon, and a very warm welcome to all of you from my side as well. And greetings from Pretoria, South Africa, where it's quite warm at the moment. But greetings to you all and welcome. And thank you for taking the time out of your busy schedules to join this webinar. It's really good to hear that most of you are not all that familiar with the collective service. I think by the end of this webinar, you'll be much more familiar with it, and specifically what it's accomplished, and where it might need to grow a bit more. So in that vein, as Simon said, this was and is a multi-agency collaborative partnership between our three organizations. And it was, in fact, created to enhance our coordination and increase the scale and quality of localized community engagement approaches in one very particularly rapidly evolving crisis we're all familiar with. That is the COVID-19 pandemic. Since its beginning around COVID, the collective service has in fact responded to the needs for health interventions caused not only by the pandemic, but other epidemics and natural disasters now reaching 5 continents: Africa, Middle East, Asia, the Americas, and Europe. And again, this collaboration among our three organizations was intended to help us avoid duplication, first and foremost, and more positively, to build on each other's knowledge and comparative advantage, leveraging our combined experience, resources, and networks in a smart way to address the complex global issues around these challenges more effectively. Obviously, the COVID-19 pandemic showed us that the challenges of working together were of a magnitude that no single organization could adequately address alone. So we didn't have a choice. There was an imperative for us to come together to figure this out. So out of crisis came opportunity, is another way you might think of that. So this collaboration has been a formidable one in two ways. Not only in the fact that it represents a pretty unprecedented coordination effort and collaboration effort among our three organizations around the acute crisis that became a chronic crisis of the pandemic. It's also a formidable collaboration in the sense that the joint management of this evaluation, while not unique, it has been somewhat uniquely, I don't know, maybe my colleagues will correct me if I'm wrong, maybe not entirely smooth. There are always challenges associated with the joint management of anything. But thanks to a really, really excellent team, you've already met Simon, who is our team member, Simon Betishofo, but also my former WHO colleague, Anand Shivasankara Kurup, and our IFRC colleague, Miki Tsukamoto, really worked very, very hard, and not just hard, but nimbly and smartly to produce a really solid analysis together with the consultants you will hear from to make this evaluation a success. So I'd really like to give a shout out to them and thank them. So what was the purpose and the nature of this assessment? It was really intended to assess the achievements of the collective service so that it could inform the strategic vision for the service moving forward. As Simon said, you'll hear in this presentation the key findings, conclusions, recommendations that emanated from the evaluation. You'll have plenty of time to react to and ask questions about those. So before closing, I just wanted to thank not only the evaluation management team, co-management team, also everyone who was really directly involved in making the collective service in pretty challenging circumstances, I think is an understatement, to really come to life. And as you'll see, produce some really impressive results under a lot of duress, but also the many others who might not have been directly related to the cooperation, but who made it a success anyway. So thank you very, very much. Now, just by way of where we are right now, the management response to this evaluation, which is a requirement of all evaluations, and I believe all three of our organizations, that management response is currently still under discussion. So please do feel free to share your thoughts, reactions on what we're talking about, because it could well inform that management response as well. I'm confident that after all the work, the blood, sweat, and tears, so to speak, I don't think there were tears, but certainly a lot of energy and time and effort that went into this evaluation, not just by the evaluators and ourselves, the evaluation managers, but also the steering committee itself, first and foremost. I'm confident that after everything that's been put into this, that the evidence generated by this evaluation will really help lead to really meaningful action on its recommendations in a way that really shapes the future vision for the collective service. So welcome. Thank you very, very much. Unfortunately, I have another commitment in about 15 minutes, so I'll have to break around then. But thank you very, very much, and I'm excited to hear more myself. Back to you, Simon.
Thank you so much, Rob, for these opening remarks. With that, I believe the stage is set, and it is high time for us to move into the presentation. As you already heard, we will start by learning more about the collective service. And for this, I'm happy to hand over to Diane Lecorvec, who is the global coordinator of the collective service. Hello, Diane, and good afternoon to you.
Hi, Simon. Good afternoon and good morning to everybody. Thank you so much for being here, for participating to this webinar. I think it's a really great opportunity for us to really present to you a short introduction and background of what the collective service is about, because I understand that probably half of you don't really have an idea of what it is and what we do. So I'm gonna be as efficient and quick as possible, and please, of course, don't hesitate to reach out through the chat or afterwards in the question and answers question if you have any comments or questions. So really going back to what Robert has said is really why the collective service was created. Well, it's a pretty simple answer, I would say. It's really to make sure that, you know, agencies such as WHO, IFRC, and UNICEF actually came together when the pandemic hit and really kind of had a common diagnosis, I would say, which is basically that the pandemic response would actually start at the community level, and really making sure that, you know, we really engage communities, vulnerable people as well, and really making sure that there's a hook, you know, at community level when it comes to pandemic response. We have learned over the past decades that this this really important pillar was lagging in some outbreaks response. When we think about, for example, the Ebola outbreaks a few years ago, where we saw that, you know, we were actually learned from the lesson there, where we really needed to do better in terms of coordinating the efforts of all institutions that are actually involved in the response and also in the preparedness of such disease outbreaks. So really understanding that there was a really urgent need. And I think it's really interesting to reflect back from where we were back 4 years ago now, when the pandemic hit, and really having this way of collaborating and really bringing each agency's added value to the table under a common umbrella, under a common agenda, to really make sure that the approaches that were actually brought up through the pandemic were really respecting communities' needs, concerns, and really having this kind of hook within communities across the world, because we're not talking about, of course, only one region, but for the pandemic, it was, of course, really worldwide. So really understanding how you know, communities were affected by this pandemic, and having a system in place where we could actually coordinate efforts was really the key there back in 2020. So maybe I'll move to the next slide, Simon, if that's okay. So here's a short visualization of how the collective service is working. So as you know, of course, the main agencies that are actually behind the collective service are the ones highlighted in orange: IFRC, UNICEF, WHO, and GORN. GORN, which actually stands for Global Outbreak Alert and Response Network, which is a network that is hosted by WHO. But of course, we work with many different organizations and institutions at all levels, which is basically at global, regional, and country level, of course, because there's need to have these linkages with people who are actually doing the work already, and really making sure that we coordinate, that we're efficient in the way that we use resources, and we're also, of course, efficient in the way that we reach out to people, to communities, making sure that there's a great integration of community engagement and risk communication in the response of any outbreaks. So it's really a way also for us to show that It's a really needs-based initiative. So responding to the needs of ministries of health, of institutions, and at the end of the day, of the communities that we want to serve in the end. So really, this is a nice kind of landscape of a diverse range of partners that have been involved with the collective service so far. Next slide, please, Simon. So the collective service strategic approach is the one that you see here. I just want to note that given the evaluation process and given that the outcomes that you will actually hear about afterwards are currently nurturing the next strategic vision, these are the strategic priorities that we have for now, but that actually might be adapted according to the current context worldwide. However, as a first core pillar of the strategy, we have, of course, the support in coordination. So really increasing, the level of communication, of coordination, of collaboration across partners to really make sure that we're being effective in reaching out to the communities that are affected by outbreaks, and of course, working very closely with the governments and their partners to the closest possible. We also have a second pillar, which is around data. So really making sure that whatever data we collect through, for example, community feedback mechanisms, through rapid qualitative assessments, for example, are actually collected in the best way possible, actually analyzed, and also used for decision-making ultimately to be able to adapt to the needs and to the concerns of communities that have been either interviewed or discussed with, etc. And then, of course, the third one is really related to the surge and deployment capacity that we have developed over the years, and really understand that this is a needs-based and request-based pillar, which means that any country that would actually request support through the collective service will do that in a formal way, and making sure that whoever is best placed to actually provide that support will be actually engaged in that. So it's really on-demand capacity, as you see highlighted here in the slide. Next slide, please, Simon. So here's a snapshot of the organizational structure. So trying to be as neat and simple as possible. But as you see, we do have, of course, a steering committee that is really providing strategic guidance and oversight to the collective service. Very happy to have Nedret, who's actually the steering committee chair. And it's composed of the main core agencies. And of course, we do have the Global Secretariat, which I'm part of as the global coordinator, along with other team colleagues, which are in charge of the resource mobilization, the advocacy. We also have technical leads from each agency, being able to also provide advisory support and technical assistance as well. And the same actually applies to the regional coordination team, which is currently well established in the Eastern Southern African region, along with coordinating the technical working group on RCCE, with a coordination function, with a search support function, as well as with information management function. So this is something that has been established in the last few years and really strengthened through the collective service support. And then, of course, you see the countries which are, of course, the main drivers of the collective service with, the response needs and with the requests that they can make directly through the collective service. Next slide, please, Simon. So here's a nice map of where you see basically since 2020 how the collective service has been providing support to countries on a different set of services, either through RCC coordination, information and knowledge management, with social science services and expertise, for example, and through all the list that you see here on the link side, which is a pretty diverse set of services that has been provided since the last 4 years. Of course, between 2020 and 2022, the core focus of the collective service was around COVID-19 pandemic response. But throughout, and given the kind of epidemic curve that has, decreased, and the new era of the collective service has really been able to learn the lesson from how we actually worked through the pandemic to be able to adapt these approaches to other types of outbreaks, such as cholera, for example, which is very big in the agenda, especially in the African, sub-Saharan African region right now. So this is really showing you a bit of what we've been supporting so far and the areas of support that we are focusing on. Next slide, please. And maybe I'll stop there. I hope this was useful for you. It's really a snapshot of information, but don't hesitate to reach out through the chat, and I'll be happy to take any questions. Thank you, Simon. Over to you.
Thank you so much, Diane. And let me also reiterate what you just said and invite all of you attendees, participants, to make use of the questions and answers functions if you have anything that you want to share or raise. As we now all learned more about the collective service, we want to quickly give you some background on the evaluation that was now conducted. So on the purpose and approach of it, the evaluation was carried out last year at the request of the collective service partners, so the organizations involved, and its purpose was to assess the collective services' contribution to strengthening risk communication and community engagement systems in the public health and humanitarian response to the COVID-19 pandemic. And at the same time, to make suggestions and recommendations to the service partners' decision makers on the future strategy, vision, and coordination model, especially in light of the receding pandemic, to inform the way forward for the service. Here, just a quick look at how this evaluation was governed or managed. So as mentioned already, this was done jointly by IFRC, UNICEF, and WHO. We had an evaluation team consisting of 3 external experts implementing the evaluation. One of them, the team lead, will just present to you the findings in a bit. And I also saw that another colleague from the evaluation team, Magdalena Isaurralde, is also connected today. Also welcome to you. And we had focal points from each organization for coordination and a reference group that supported the evaluation in an advisory capacity consisting of key stakeholders and experts both from inside and outside the organizations. And the evaluation covered the timeframe 2020 to 2022, looking at collective responses to public health and humanitarian emergencies, particularly those supported by the service. A very quick look at the methodology, so the data sources that went into this evaluation and got then analyzed to synthesize the findings that you'll be presented today. So in principle, that was mainly a document review from different sources, 88 key informant interviews with different key stakeholders and experts, an online survey targeting individuals involved at a different levels, so headquarters, regional, and country level, and 4 case studies that looked at the progress of collective risk communication and community engagement at country and regional levels. With that said, I would gladly now hand over to our main presenter today, Simon Laurie-White. Simon was the leader of the team that implemented this evaluation, as already mentioned. He's an expert in organizational performance and evaluation and has been the manager and leader of more than 50 organizational management reviews and humanitarian and development evaluations. Simon will now take us through the results of this evaluation. Simon, over to you.
Thank you very much, and I'm delighted to be able to share a summary of the results of the evaluation with you today. I'm speaking on behalf of the team of 3 of us, Juan Seclen, Magdalena Isaurralde, who's online with us today, and myself. And I'm going to go very rapidly through the findings, the conclusions, some options for the future, and the recommendations. It's going to be very brief, so I will be sort of bouncing across the surface of this. There is much more depth to be found in all the various reports, which you will find from the links that will come up at the end of this presentation, including the case studies annex. So to move to the findings on relevance, first of all. So the decision to launch such a service was the right one. It was appropriate, necessary, and timely to bring our CCC efforts together, especially given that coordination in the past had not been so good, as Deanne has already outlined. And again, Deanne showed a slide with many different types of actors, and the RCC Collective Service was able to bring many different types of actors together at the global level. Those working in communications and media, medics, obviously, emergency personnel, those working on social behavior change, to come together in one collaboration, which was quite an achievement. And then as time went on and the pandemic receded over time, as the emergency went down, moved into a chronic phase, the service also evolved to respond to cholera, Ebola, and drought in Africa. Next slide, please. The Collective Service developed a theory of change at the outset, which proved to be sound and a good foundation for planning the work, although there was a gap in the theory in how to engage stakeholders, rather than making the assumption that stakeholders would necessarily get on board, which was not necessarily true, and some countries indeed did not engage who were invited to. The Collective Service achieved a name recognition over time as time went on, but that was double-edged in that it made the service appear to some people as being distinct from the core partners themselves. And that question of the naming is still out there as an issue for discussion, as we'll see at the end. We did an online survey, and one of the questions we asked whether the service would be required again in the future if future health emergencies or major health emergencies came along, and the answer was a resounding 87% who thought it was likely or very likely. So that gives some sort of pointer to whether it's needed for the future or not. Next slide, please. Some of the contributions provided by the Collective Service were a comprehensive set of guidance, methods, and tools, which were positively reviewed in terms of their technical quality. There are a lot of different working groups, subgroups, who are active as part of the coordination effort, and they produced a lot of materials, not all of which could be properly absorbed at the field level. And that's quite common in emergency situations, that more guidance is produced and can actually be used productively on the ground. The GORN network that Deanne mentioned earlier did a very good job of organizing the global video conferences, which were very well attended and productive, especially for the first year in the sort of peak phase. And GORN has actually gone on coordinating discussions since then. Regional coordination also proved effective, and if we had time to talk about all the case studies, we would explain how the coordination played out differently in different regions. But in East and Southern Africa, it's been able to develop to the greatest extent because it's had a continuity for 3 years or so now. Data for action, which was a concept devised for this initiative, proved to be very, well, not just conceptually strong, but also very useful in its application, because it brought together social sciences, information management, monitoring and evaluation to inform program design at country level, and was combined with research and community feedback, which we'll talk about more in a minute, in the target regions and countries. There was a help desk launched in 2022, a little bit later on in the piece. It wasn't very widely advertised or utilized, although it has been given additional purposes since then. Next slide, please. There was a lot of training on coordination, social science, community feedback, and information management, which reached thousands of participants. Much of this was online, of course, but because of the nature of the pandemic, latterly at some face-to-face. We were not able to find any analysis of the effectiveness of this training, however, although anecdotally we were told that some of it was, but for the future, it will be necessary to have a better hold, better understanding of where this capacity building is working and not. It was a very, well, traumatic time, difficult time, especially in the early stages, and it was very important for learning at global level, country level, and between the regions. And the collective service did a good job at those different levels of exchanging experience between organizations. We did not find much effort going into the preparedness planning for the long-term systems development planning for preparedness. Of course, in the initial emergency phase, you wouldn't expect that, but looking to the future, the systematic capacity development of health systems will be a priority. I've made reference already to high quality guidance materials and tools which were developed by the service, including on youth, children, women, migrants, and refugees. But in practice, we did not find much attention to equity, certainly not clearly enough coming out through the work. That's another area for attention. And because funding tended to be short-term and limited, it wasn't possible to meet all of the objectives that the service originally set for itself. Next slide, please. I wanted to take a moment to run through some of the factors which made RCCE effective at country level. So where there was best practice examples, these factors were all present. And I want to run through them because, after all, in the end, it's RCC implementation at country and community level, which is where the difference is made. And I wanted to just highlight that where RCCE is included as a pillar of the emergency incident management system, that means it's plugged into the government's health emergency response processes, and where RCCE was coordinated between government, UN, Red Cross, and non-government organizations, often under the leadership of the government itself. This proved effective. And in the best examples, there was a two-way communication flow of information going from the center to community level, district level, and back again. And again, in some countries, there were multiple feedback channels through the core agencies themselves, but also through other organizations working as part of the big coordination group. And of course, it actually can be challenging to combine and reconcile various streams of community feedback coming into the center. But where this was strong and where it was analyzed, it then had a very important effect on RCC implementation. And going back to what I was saying before about the use of analysis, of situation analysis, community feedback, media analysis, social anthropological studies, bringing them all together provided an important evidence base on which decisions could be made at country level. Next, please. There were various challenges, and I'll take the first 2 points together. The service was launched very quickly, and a funding application was put together very fast. And there was not much consultation at HQ level, and there wasn't any consultation with regions at all. So when the collective service was announced, it felt to those in the regions who were already working on RCCE coordination that this was a sort of top-down imposition from HQ that produced a certain amount of pushback and resistance, which it took some time to resolve. And in West Africa, West and Central Africa, the additional capacity provided by the collective service was implemented for 1 year, and in Eastern Southern Africa, it was extended over a longer period. The bulk of the funding was for Africa. That doesn't mean that RCCE coordination only took place in Africa. It didn't. The other regions found their own solutions, also with support from the collective service. There was a generally very good partnership working between the 3 core organizations. There were a few instances of competitive behavior that eroded trust, and the partners in the coordination group, of course, understandably get very frustrated when the core organizations are not in agreement and are competing with each other, which then slows everything down for everybody else. However, these were relatively few instances, we felt, and honestly, when you have major emergencies, there are always competitive behaviors going on. As long as they're kept to a reasonable level, that's normal. There was a challenge, and there has been a challenge since 2021-22 for the steering committee not being able to resolve the future direction of the service, especially how far the service should be focusing on and working in parallel with the IASC accountability to affected people agenda, and or the health emergency and health emergency preparedness and response, or so-called PEPA agenda led by the WHO, and that discussion continues to this day, I imagine. Next slide, please. As I've already talked about the funding constraints, I won't repeat that again. Just that funding started to fall off after the first year, and especially with the war in Ukraine, funding was further diminished and remains a challenge today. The strong commitment by the staff members and the organizational focal points of the service were able to overcome some of the challenges. And unfortunately, the work of the service was not well recognized or supported by the senior management of the core partners. And again, that probably goes back to this idea of it having been kind of launched as something that appeared to be separate, even though it wasn't really. Performance monitoring, performance indicators and a results framework were devised for the collective service, but the data collected was mostly about activity and outputs and much less about changes at the systems level, which is understandable at the beginning of an emergency. That's typically what you'd expect, because you don't have, it takes time to see what the system changes are, but this is still an area that needs work. Next slide, please. So moving on to some conclusions. Next slide, please. So on the left-hand side, that's pretty much a summary of the things that I've been talking about so far. And just to say that there is an enormous amount to build on for the future. And on the right-hand side, just a kind of a memoir of the things that did not work out so well and need attention. One perhaps I haven't mentioned so far is that the partnership agreement between the three core agencies was developed very quickly. It was very light, rather weak in terms of accountability, mutual accountability between the organizations, and I'm sure in future a stronger version will be devised for the next phase. Next slide, please. So we were asked to come up with options for the future, and after quite a bit of discussion and to and fro with the reference group, we came down with these three options, which I'll just take a minute to explain now. So the first option was to really change the approach somewhat, to be a more what we've called nexus approach, meaning a combination of the institutional development capacity and programming of partners, and combined with health emergency preparedness programming. In other words, a longer term, more in-depth approach to institutional development, especially of government capacity. Option two is more or less the status quo, the collective service as it is. And then within that, there's the options to keep the focus within East and Southern Africa, to expand to all of Africa, or to add in other regions as well. So option two is the collective service a bit as it is now, but just having to determine what scale and breadth it would be operating under in the future. Option three was just to say, well, regions are all different. They have their own dynamics. They already have their own RCC coordination processes. So why don't we just let them get on with it? Do we need HQ telling them what to do and providing them central direction? Maybe not. So those were the three options, which were basically presented as a way of advancing the discussion. No particular option was recommended, and no option has been decided on at this point, as far as I know. Next slide, please. Next slide, please. So the recommendations, so 12 recommendations altogether. The first was that there should be a joint policy statement on the need to coordinate RCCE in countries and crises where that's relevant. This is to kind of bind all parts of the organizations together into understanding the importance of the initiative and not leaving it floating somewhere without senior management endorsement. Recommendation two was to adopt a set of success criteria, which are described in the report, and I'm sorry, I haven't had time to include that in the presentation. Recommendation three, to devise a new vision and model, which I know, as Deanne says, there's already been work on this. We recommended that there should be a facilitated process to bring people together to come up with a joint vision. Recommendation four was that the work of the collective service should be based much more on a sound analysis of the national capacity for RCCE in at-risk countries. So that you're starting in each country, which of course is really the unit of operation that matters. You're starting in each country from the basis of knowing what the capacity already is and designing for each country what needs to be done to assist. Recommendation five, all the core partners were keen on expanding the membership of the collective service one way or another, and various options are discussed in the report. And it was just, the recommendation is really about making sure that the selection of partnerships lines up with the defined priorities of the service. Recommendation 6 was to explore the potential for interlinked funding proposals which are plugged into global priorities and global initiatives, for example, on pandemic preparedness and the work of the IFRC that on accountability to affected people, as I mentioned before. In other words, to bind the service more closely to other major global priority policy initiatives. Next slide, please. Recommendation 7, there was this ongoing discussion about how closely the collective service should be tied to the work of the IFRC on accountability to affected people. In the report, we recommended that it should be linked rather than merged together. There's a question about whether a pooled funding mechanism would work well for the collective service, because there were challenges in terms of how you give money to one agency and then share it with another agency. If you have a pooled fund, it might be easier to manage. That needs to be tested in its feasibility. Implementation of a standby mechanism. I actually don't need to say any more about that because Diane already talked about that in her short presentation. Revise the theory of change to close the gaps that were identified. I mentioned some of that at the beginning. And then there's the issue of the name of the collective service, balancing it to the disadvantages and advantages of having a distinct and recognizable name, and the disadvantages of appearing to be operating as something separate from the core agencies themselves. And then recommendation 12 was a purely pragmatic one to say, given that we made our recommendations in 2022, that they should extend the life of the service for sufficient time to allow agreements to be put in place for the launch of the next phase of the service. Thank you very much. With that, back to you, Simon.
Thank you very much, Simon, and your team for these insights on the evaluation results. This now concludes our part on the evaluation. We have 10 minutes left, around 10 minutes, which we would like to use for an outlook on next steps. As already mentioned also earlier by Rob, as this was a full-fledged evaluation in line with international norms and standards, there's also a management response process to it, which means that the key actors addressed by the recommendations have been requested to respond to these. This management response, which we also already heard, will ultimately define the next steps following this evaluation, and it's currently still being finalized by the Collective Service Steering Committee. We do, however, have the pleasure to welcome today Nedret Emiroglu, who is the Director of the Country Readiness Strengthening Department at WHO and the Chair of the Collective Service Steering Committee, who will kindly share with us an outlook on these current discussions on next steps. Nedret, over to you.
Thank you so much, Simon, and thanks to you both for excellent presentation of the results. And I'd like to thank the whole evaluation team on behalf of the steering committee members, so WHO, IFRC, UNICEF, as well as GORN. So before the next steps, let me just start sharing a few views on what the collective service as an initiative is. It is an extremely valuable and unique partnership. So it is building upon the strengths and complementarily on the mandates of each agency, and building upon those strengths, try to bring the needed support to the countries, to the communities, to the sub-national level. So actually it's a bottom-up approach rather than a top-down. And it's a lot needs-based, and it's a lot of science, social, including social science, evidence-based, to create the synergies and with the one coherent key messages to the endpoint users. So it was, as you heard, established in the middle of the COVID. So relatively from a global public health perspective, it's relatively new. But at the same time, it did not stop only in responding to the needs with COVID. As the new emergencies came, as you heard from Diana as well, that with the Ebola, Mpox, cholera, hepatitis, various dengue, the different disasters, there has been teams working together. And it is embedded actually in many of the global major processes ongoing on the preparing the world for a next pandemic, either within the WHO's IHR amendments, International Health Regulations amendments, or the intergovernmental negotiating body, which is discussing a possible pandemic treaty, which is going to be binding for the member states, or as you heard from the ISC, AAP agenda. So there is a huge recognition on the importance of putting the communities at the center. So this is what we hear more and more from member states, from various partners, from different networks, and the need is to recognize, to work together with the communities, to empower them, to engage them so that they are ready, resilient, and be able to respond effectively in an emergency. And that requires broad partnerships at all levels and engaging all different stakeholders. So within this, all these needs, which is a huge and within this complex global environment, the findings of the evaluation team is being reviewed very in deep detail by the steering committee. As you heard, yeah, we are in the process of the management response, but basically we agree with most of the findings, maybe except one. I will say that I see the full commitment from all agencies at the senior leadership level that actually brings us to the strategic discussions on the continuation of the collective services. So there's a lot of value on continuing this. There's a huge demand, there's a huge need, and we own this, building upon the gains from the collective services to build that synergy, alignment, coherence, and building that capacity that is what we owe to the communities. So, and at the same time, as the experience has shown, by default, the emergencies at the global level are complex in nature. It's difficult to actually differentiate health and humanitarian emergencies. They are inter-triggered and actually happening in together with the others. So the current thinking within that is that it's going to be more emergency prioritization and actually covering also the health as well as infectious origin or the humanitarian emergencies. And the steering committee is at the final stages of discussing all that new strategic vision and the scope and the collaboration mechanism, and we hope that the new vision is going to be ready by June. But at the same time, I can assure everyone that the work is ongoing in supporting the response in many emergencies. So thank you very much once more to the evaluation team. The findings has been extremely useful and valuable to strategically shape the second phase of the collective service, whatever name you're going to give it, whether we're going to keep the name or change as one of the points raised, but extremely useful. Thank you very much. Back to you, Simon.
Thank you very much, Nedret, for that outlook. With that, we are actually through our presentation today. The not so good news is that we have not much time left for any questions. The good news is that it seems there haven't been any so far in the chat. So what I would encourage all of you is, if you still do have any questions related to what we presented today, to the collective service, to the evaluation, please do reach out to us, to any of the panelists today who you think is best placed to answer them, or using one of the email addresses that are indicated here of the different evaluation offices. You can also use your smartphone to scan the QR codes that you see on the screen, which will directly bring you to the respective pages of the organization's evaluation offices, where you find all the reports and related material to this evaluation. And with that, we would like to close this webinar. And let me use that opportunity again to thank my colleagues Miki Tsukamoto, who just came on screen, and Anantya Sankara-Kurup, who have also both been part of the joint management team. Also thanks to Robert McCouch for being here today with us, to Diane Lekorvek, to Simon Laurie White on behalf of the evaluation team, and to Nedret Emiroglu for the insights they shared with us today. Also, let me thank Montse Voss, who has done the French translation channel to accommodate that. And most importantly, many thanks to all of you in the audience for joining today. We hope you enjoyed this session. Do not hesitate to get in touch for any further information, and have a very good rest of your day. With that, we are on the hour, and all the very best. See you on another opportunity.
Thank you, Simon. Thanks all. Bye.
Thank you all.
Thank you. Bye-bye.
Thank you very much and goodbye.
Thank you.
Bye
Bye-bye.
bye.